And in light of the fourth wave of COVID-19, hospitals in the western region are now on high alert for COVID-19. Shamela Pullen has the details.
The third wave of COVID-19 swept through western Jamaica in 2021, with hospitals bursting at the seams with sick patients. The Savlamar Hospital in Westmoreland was worst affected. Now, the country is experiencing the fourth wave, and once again, bed space could be an issue.
For the region, I can tell you that currently our general bed occupancy is at 75%. Our COVID bed, because we have special bed spaces identified for isolation, those beds are 27% occupied now. With the bed occupancies, when we looked at them, the only one of real concern that was extremely high was the Savlamar Public General Hospital, which was at about 106% bed occupancy. We have been watching that situation for some time.
It's believed the current rise in COVID cases is largely due to the Omicron variant, and although the symptoms are said to be mild, clinical coordinator for the Western Regional Health Authority, Dr. Delroy Free, says he's cautiously optimistic that there will be fewer hospitalizations.
With what is happening worldwide, we should still be aggressive in how we conduct ourselves in terms of the crowd, overcrowding, the wearing our masks, etc. We cannot afford at this stage to let our cards down. So what we'll see is within the next week or so, we will see what happens with hospital admission.
There is an expectation that the true impact on hospitalizations will likely be felt 3 weeks after the surge in COVID cases.
When the surge hits, we know there's an 80% bed occupancy. When we hit that, we go into emergency mode. We send out home patients we can send home. We know exactly where to put the various surge beds, etc., so that people can be properly isolated. So I'm glad that can be done. And we watch as the fourth surge comes, but I know we are far better off now than we were in September.
The West is still without a field hospital, but Mr. Clark says efforts are being made to have the facility up and running soon.
The tent is up, the electrical works are done, the tent is tiled. It is built for 35 beds, easily spaced. When we get into surges and whatever, we can easily hold 50 people there. And it may well be the one field hospital for the region that can pull us through. We do have field hospitals at Noel Home, and the one for Falmouth was completed last year as well.
Meanwhile, Mr. Clark says while the vaccine take-up has improved, there is still some way to go, as currently most of the people getting sick are the unvaccinated. Shamela Pullen, TVJ News.